Subtle changes in walking pattern. Your walking pattern reveals more about your brain health than most people realize. Neurologists have discovered that specific changes in how you walk can signal cognitive decline 2 decades before memory problems become apparent. This connection between movement and brain function has revolutionized early detection methods in 2025, with Gait analysis now serving as one of the most reliable predictors of future dementia risk. Recent longitudinal studies tracking thousands of participants over 25 years have identified precise walking characteristics that correlate with cognitive decline. Researchers focus on 2 key measurements that reveal the most about brain health: stride length and walking speed. These measurements reveal subtle changes that occur years before traditional cognitive tests detect any problems. The brain regions responsible for walking overlap significantly with areas affected early in dementia, creating detectable changes in movement patterns long before memory centers show damage. Stride length reduction represents one of the most significant early indicators discovered in 2025 research. Normal aging typically reduces stride length by approximately 2% per decade after age 60. However, individuals who later develop dementia show stride length reductions of 8 to 12% during the same time frame. This dramatic difference occurs because the brain's planning and execution centers begin deteriorating, affecting the complex coordination required for normal walking patterns. Foot placement patterns also change in distinctive ways during early cognitive decline. Healthy older adults maintain consistent foot positioning with minimal variability between steps. People in early stages of dementia show increased step width variability and irregular foot placement, even when walking on flat, familiar surfaces. This variability indicates that the brain struggles to maintain consistent motor control, suggesting underlying neurological changes that precede obvious cognitive symptoms. Balance problems associated with early dementia differ significantly from typical aging-related balance issues. Normal aging affects peripheral systems like inner ear function and muscle strength, causing predictable balance challenges. Dementia-related balance problems stem from central nervous system changes affecting spatial processing and motor planning. These individuals may appear steady while standing still but show subtle instability during walking transitions, turning, or navigating obstacles. Coordination difficulties manifest as seemingly minor changes. Examples include taking smaller steps, holding arms wider for balance, or lifting feet higher than necessary when walking. These signs families often miss indicate that the brain has begun struggling with spatial processing and movement planning. A person might show hesitation before stepping off curbs or over thresholds, revealing compensatory behaviors that suggest underlying neurological changes. The 2025 findings reveal that walking speed changes predict dementia risk with remarkable accuracy. Individuals whose walking speed decreases by more than 0.1 meters per second annually face 3 times higher dementia risk compared to those maintaining consistent speeds. This measurement proves more predictive than many traditional cognitive assessments, leading to widespread adoption of walking speed monitoring in clinical settings. Clinical applications of Gait analysis have expanded dramatically throughout 2025. Major medical centers now use computerized walkway systems that capture hundreds of data points during a simple walking test. These systems detect changes invisible to casual observation, measuring factors like step timing variability, heel strike patterns, and weight distribution between feet. Healthcare providers can identify concerning patterns years before patients or families notice walking changes. Movement alterations occur early because walking requires integration of multiple brain systems. The frontal cortex plans movement sequences, the cerebellum coordinates balance and timing, and the basal ganglia control movement initiation and stopping. Dementia affects these interconnected regions simultaneously, creating detectable walking changes before isolated cognitive functions show obvious decline. This multi-system involvement explains why Gait analysis proves more sensitive than tests focusing on single cognitive domains. Family members should watch for specific walking changes during daily activities. A person might begin holding handrails more frequently when available, even on familiar staircases they previously navigated confidently. They may start pausing at the top or bottom of stairs, appearing to plan their movements more deliberately. Walking through doorways might become more cautious, with slight hesitation or wider clearance than previously needed. Shopping trips often reveal early walking changes that families dismiss as caution or fatigue. The person might walk more slowly through store aisles, maintain closer contact with shopping carts for stability, or show reluctance to navigate crowded areas. These behaviors indicate emerging spatial processing difficulties and reduced confidence in movement control, both early signs of cognitive change. Recent case studies demonstrate the power of early intervention based on Gait analysis findings. A 72-year-old woman whose walking speed had decreased by 15% over 2 years received comprehensive evaluation, revealing early-stage cognitive changes. Immediate implementation of physical therapy, balance training, and cognitive exercises slowed her decline significantly compared to similar cases without early intervention. Another case involved a 68-year-old man whose Gait analysis revealed increased step variability despite normal cognitive testing. Early intervention, including targeted exercise programs, medication adjustments, and lifestyle modifications, helped maintain his walking stability and cognitive function for an additional 4 years beyond typical progression timelines. These outcomes highlight the importance of recognizing and acting on subtle movement changes. Physical therapy interventions designed specifically for gait-related cognitive concerns have shown promising results in 2025 studies. Programs combining balance training, coordination exercises, and dual-task activities help maintain walking stability while supporting cognitive function. Participants who engage in these targeted interventions maintain independence longer and show slower progression of both movement and cognitive symptoms. Technology